Hi, I'm Dr. William Richardson, and I'm here to tell you that you can end erectile dysfunction now. My friends, today I want you to truly know that you can end erectile dysfunction right now. I want to welcome you to Dr. Richardson's Reversing Erectile Dysfunction program, where we most certainly intend to uncover and solve the underlying root causes of erectile dysfunction once and for all. The fact is that over 30 million American men suffer with erectile dysfunction. Indeed, it's an epidemic. Then here comes the drug companies with Viagra, Cialis, Levitra, etc. to the rescue. Erectile dysfunction drugs cost Americans $2 to $3 billion per year. Erectile dysfunction drugs can have serious side effects including headaches, nausea, liver toxicity, sinus congestion, change in vision, back pain, and even death if used improperly or with underlying heart disease. Also, ED drugs do not get to the root causes of erectile dysfunction. ED drugs only treat the symptoms. Moreover, statistics on ED are showing us that 7 out of 10 of erectile dysfunction cases are caused by potentially life-threatening conditions such as clogged arteries, hardened artery disease, diabetes, hypertension, lurking heart attacks waiting to happen, and imminent strokes. Therefore, this is a grand opportunity to clean up your entire health picture and also end erectile dysfunction now and forever. Dr. Richardson's Reversing Erectile Dysfunction program is designed to increase your circulation, increase your energy and vitality, to ultimately reverse erectile dysfunction and improve your libido. A large part of our ED reversal program really targets the problem of poor circulation and blockages in the artery. Studies reveal that the real statistics about atherosclerosis, which is really hardening of the arteries, demonstrates that in the 50s, 85% of Americans have hardening of the arteries. In the 40s, 71%. And in our 30s, 60% of Americans have hardening of the arteries. So if you're over 30, that means the chances are you pretty much definitely have hardening of the arteries. Well, even in the 20s, 37% of Americans have hardening of the arteries. And from age 0 to 20, 17% of Americans have hardening of the arteries. The mechanisms of atherosclerosis or hardening of the arteries are most definitely in play when we are trying to solve erectile dysfunction. Therefore, we trust it is quite obvious that if your arteries are clogged, this will result in poor circulation to all parts of your body, including reproductive areas. Also, it is important for us to realize that from atherosclerosis, big business makes big money on the front end with the tobacco, dairy, junk food industry to the back end, all the way from drug companies to funeral homes. Studies also reveal problems with high blood pressure medications. They don't always work, and it can actually be associated with erectile dysfunction and decreased sexual libido itself. Still, yet another study tells us that cardiovascular risk factors are associated with future erectile problems, and that high cholesterol, being overweight, or smoking both increase the risk of erectile dysfunction as well as cardiovascular diseases. Also, another cause of erectile dysfunction is heavy metal toxicity, which in turn causes atherosclerosis or hardening of the arteries, which in turn causes erectile dysfunction. Also, the heavy metals will foul up the enzymatic mechanisms in the mitochondria, therefore giving us very low energy. And we're talking about pollution with lead, cadmium, arsenic, aluminum, nickel, etc. Illnesses caused by heavy metal toxicity include many, including some obscure illnesses like amyotrophic lateral sclerosis or Lou Gehrig's disease, heart attacks, Alzheimer's, but also includes erectile dysfunction. Many and most of us, and really all of us, have been exposed to heavy metal toxicity in our environments and lifestyle. Just look at the many ways we can get heavy metals. We have had many, many testimonials from patients who have received great benefits that have cured the underlying root causes of erectile dysfunction, including weight loss, high cholesterol, heavy metal toxicity, poor circulation, poor prostate health, and hypertension, just to name a few. Our first example, patient testimonial, shows that PSA normalized, prostatitis was eradicated, and the patient had more energy, strength, and endurance in sexual activities. Another patient here not only got rid of prostate cancer, lost 48 pounds with blood pressure and cholesterol normalizing. We know what effect this is going to have on his testosterone, on his durations, and power of erections. This particular patient has had several heart attacks and cardiac caths and bypass surgery, and with the treatment including disease reversal lifestyle training as well as chelation therapy, this patient was able to reverse that and definitely get improved libido. Everybody's seen the advertisements on TV regarding low testosterone or low T. I've found ways, and we introduced this through our disease reversal programs, of either increasing the testosterone or making the body more sensitive to the testosterone that is within it naturally. Because when you give testosterone from the outside and introduce it to the body, you lower your ability to make your own testosterone. In other words, taking testosterone from the outside literally shrinks your balls. Again, I want to restate that our goal is to effectively treat the causative factors of erectile dysfunction. Therefore, moving forward in the following slides, we will quickly show you study after study after study done in our office of our patients successfully reversing the underlying root causes of erectile dysfunction. Here on this slide, we see that the total cholesterol in this patient went from 254 to 175 without drugs. Another great example is a cholesterol going from 296 down to 146, and the bad going from 205 to 88, again without drugs. This is disease reversal. Still another example shows the cholesterol going from 217 to 144. The cholesterol in rural China average is 135. The average cholesterol in the US is 220. And still yet another example shows cholesterol going from 196 down to 131, and the LDL or bad going from 125 to 68. The goal with the bad is to get it under 75 in people with heart disease. Our final cholesterol reduction example is a total cholesterol going from 327 down to 125, again without drugs, and the bad cholesterol or LDL cholesterol going from 239 down to 67. Finally, here we will show you examples of patients who reverse their blocked arteries verified by Doppler studies by doing Dr. Richardson's disease reversal program. In this case, the left tibial vessel had a AB ratio going from 0.75 to 1.09, normal being greater than 1. So there was a reversal of the blocked artery in this case. And here, there was a 75% blockage of the artery going into the brain or the head, and the person was on 3 drugs, and then after our program, they had a normal study and they were on no medications. Now, let's get to the bottom line. How can we reverse erectile dysfunction? How can I help you do this? Furthermore, how can we increase circulation, increase energy, vitality, libido, and again, reverse erectile dysfunction. The solution comes in two parts. First, remove atherosclerotic plaque, and secondly, cease putting the plaque there in the first place, and also other pertinent lifestyle factors. Simple, but how? The first part is IV EDTA chelation therapy, and the second is Dr. Richardson's disease reversal, health coaching, and lifestyle counseling program. First of all, let's talk about chelation therapy. If you haven't heard of it, you should have. Really, to be honest, chelation therapy should be on the 6 o'clock news every night. Why? Because it's been around since the 40s of last century. It also removes hardening of the arteries and plaque, calcified deposits, lowers LDL or the bad cholesterol, and apparently dramatically improves circulation. Studies have shown that chelation therapy has 85% success rate in cardiovascular disease reversal. Also, millions around the world have had EDTA chelation therapy. It is actually safer than taking aspirin and is approved by the FDA for heavy metal toxicity, especially lead. Normally, a client will need a series of 30 chelation treatments. These chelation therapy treatments are indeed related to erectile dysfunction. And you say, why? Because if it gets rid of the hardening of the arteries that supply the reproductive organs, then it's going to have a positive effect, letting that blood flow back into the reproductive organs so they can function again. So what is chelation therapy specifically? Well, chelation therapy is an IV drip which contains EDTA, a man-made amino acid that has a molecular affinity for the metals that help bind together arteriosclerotic plaque. Consequently, the dissolved arteriosclerotic plaque is eliminated through the body and the heavy metals through the kidneys and excreted in the urine as well as the feces. Finally, chelation therapy is overseen by the American College for the Advancement of Medicine. And I am board certified in chelation therapy as well as preventive medicine. And I'm a long-standing member of ACAM, which is the American College for the Advancement of Medicine. Just what are the specifics and just how exactly does chelation therapy improve your love life? Well, it removes the heavy metals that foul up the enzyme systems that weaken us. It removes calcified deposits from the arteries that supply the genital organs, and therefore removes arteriosclerosis and improves circulation everywhere, including to the genital region. Doctors have observed that chelation therapy improves the strength and duration of erections. It lowers the blood pressure if it's high, which allows patients to reduce or discontinue blood pressure medications, because high blood pressure medications can count for up to 40% of male impotency. Also, chelation therapy makes males and females feel and look younger. Chelation therapy improves energy, skin texture, and mobility. It makes patients feel a lot friskier. Indeed, it increases blood flow to the thyroid and adrenal glands, which are highly involved in sexual activity. I have successfully administered thousands of EDTA chelations for the past 15 years or more. Just join our comprehensive program today. See and feel the difference on your total well-being as well as erectile dysfunction in particular. Another undeniably essential part of our ED reversal program is a patient's full participation in Dr. Richardson's disease reversal, lifestyle counseling, and health coaching program, because we know that your health depends on your lifestyle, 65%, and environment, 21%, while only 14% of your health depends on genetics, hospitals, and other health care. Therefore, your health depends on the choices you are making minute to minute, hour to hour, and year to year. There's no use of taking out the plaque that's hurting your circulation with chelation therapy if you don't get rid of the sources of the plaque in the first place through the disease reversal program. Dr. Richardson's disease reversal, lifestyle counseling, and health coaching program is engaging, comprehensive, and includes thorough plans and steps that you can take in your lifestyle and environment to reverse disease, including identifying health problems, relating it to the 15 root causes common to disease, and offering deep and thorough lifestyle, dietary, nutritional, environmental, anti-toxicity, mental, emotional, spiritual factors that contribute to the health and how to correct them. There's research for an hour and a half. There's training sessions that last hours and 13-page protocols. Comprehensive protocols using holistic medicine techniques and testing are used, and much, much more. Our disease reversal and lifestyle counseling and health coaching program, again, includes different levels. The platinum and the gold here are used as the examples in our most common programs. Here you see you get numbers of hour-long visits with Dr. Richardson, 13-page program plans, manuals and handouts, healing DVDs, as well as healing CDs. Environmental home conversion kits are available, as well as music CDs. Finally, I'm Dr. William Richardson, and I'm here to tell you that you can reverse erectile dysfunction right now using natural mechanisms. Yes, once again, my friends, today I want you to truly know that without a doubt, you can end erectile dysfunction now, and the earlier you catch it, the better. In closing, we invite you to enroll in Dr. Richardson's Reversing Erectile Dysfunction program, where we most certainly intend to uncover and solve your underlying root causes of erectile dysfunction once and for all. I want to thank you very much for listening to this presentation. This is Dr. William Richardson wishing you a great day.